Welcome back to my channel. So today's topic is monkeypox. So now after the pandemic of coronavirus, that is COVID-19, everybody are actually scared about this new thing that has come, that is monkeypox virus. So this is not a new virus. This was there long before. It was detected in 1958 itself, okay, in a group of monkeys in a laboratory of Denmark. But now this is gaining more popularity here because it was seen in endemic regions, but now even non-endemic places are getting this kind of issues. So let me give you more details about this monkeypox virus and how this can spread from one to other. Okay, so let me give you more details of that today. So it is a disease caused by monkeypox virus, as I told you, and this virus disease that causes, it is called as the zoonotic diseases. So these viruses can cause diseases, and it can cause diseases not only in human beings, even in animals. So it can spread from animals to humans. So this monkeypox virus, it is almost similar to that smallpox virus, okay, and this belongs to the family Orthopoxvirus genus and family of Poxviridae. So these were basically seen in African countries, so Central Africa and Western Africa. So in those regions, this was predominantly seen. But because of travel history and other things, there is a chance that this can spread from those countries to other countries. So that is what is happening now. So this is just to show you the cases, okay, all around the countries and in the Western Africa and Central Africa, as I told you. So there the rates are more, I mean the cases are more, but this is not very fatal. Okay, actually it is not fatal, but if you are immune compromised, you have a lot of comorbidities, then there is a chance that this can lead to complications. So this is just to show you the years and the number of cases, how it is increasing. So this is initially, you can see in 70s, 80s, 90s, the cases were very minimal because it was there only in remote areas. But now you can see because of travel history and other things, it is getting transmitted from one person to another, and it is leading to something like a endemic or pandemic situation. So how this transmission happens, okay? So how this virus can transmit from one person to another. So as I told you, the host for this can be both humans and animals. So they can transmit from one another. Okay, so it can be by direct contact or by indirect contact. Like if you have some lesions on your skin and you go and touch some animal which is infected by this monkeypox, then through the lesion, the virus can enter your body. And indirectly through respiratory droplets, this everyone knows now. That is why we have the regulations for COVID. We have already used all that. So respiratory droplets also can contain virus, and that also can lead to the spread of this monkeypox. So coming to the symptoms are almost similar, like you may have fever, headache, muscle aches, body pain. So those kind of symptoms are commonly seen. One thing which is not very commonly seen, which might be a plus point here to identify if you are suffering from this, is swollen lymph nodes. Okay, so this is one peculiar symptom that is seen in this particular condition, that is your lymph nodes. So basically we'll have lymph nodes in various areas of our body, and major lymph nodes are present in the neck region. So if you see the swollen lymph nodes, swollen nature of your neck, that might be one thing that which tell us that it might be a case of monkeypox. Okay, similarly skin rashes is one more thing which is a major symptom of this particular problem. You can see the images here. So this is how the lesions might look like. So your skin lesions might be filled with even fluids like yellowish color fluids, and this lesions might be varying, like it might be from 100 to 1000 from one individual to another individual. Some might have 100, some might have 1000. So it can vary from the person to person based on the severity. So coming to other things here, where exactly these lesions might be formed. So it can be formed in various parts of your body. The most concentrated regions will be face, palms, hands, sole, genital regions, eye region, mouth region. So these are the major areas where these kind of rashes will be seen. And as I told you, newborn children and people who are immune compromised, definitely they will be at higher risk of developing these symptoms. So how does it spread? So from one person to another, through direct contact or indirect contact, it can spread, and the person becomes infectious for 2 to 4 weeks once he encounters this particular virus. So close physical contact through body fluids, are one main reason for transfer of this organism from one person to another. Another is maybe somebody is suffering and you are trying to help them out. By mistake, you touch them, they had a lesion on their body and you touch that area, you don't have a proper washing of your hands, hygienic conditions are not maintained, then also you can get contaminated, and there also the virus can spread from that person to the next person. So in this way, there are a lot of ways by which it can transmit. So you need to take very much care here, and personal hygiene is very, very important. Even it can spread from pregnant lady to the fetus, through the placenta during pregnancy, or even after delivery through skin to skin contact from the mother to baby, again it can spread. So in this way, initially there was a hype like if there are gay partners, then there is a chance of this monkeypox, but this is not something to do with that. This is basically anybody can get this if they are in contact with somebody, some other person who is already having this virus in them. So basically, household members, like if one person is suffering in a family, the members in that family are at risk, and the sexual partner is definitely at risk. So that is why you need to give proper precautions here, and you need to follow the regulations so that the virus does not spread from that person to the next person. So coming to the diagnostic options, we have the main gold standard, that is the PCR, that is the polymerase chain reaction. So this will be used for sequencing. So NIV Pune, okay, so this is recently been designated as the nodal laboratory for monkeypox virus testing in India. So these labs will help in identifying by doing this kind of PCR, that is polymerase chain reaction, to tell us if that organism, that is the virus seen in that sample, is monkeypox or not. Okay, so it is based on the monkeypox virus or not. So recently there was a case in UP where the samples were sent to NIV Pune, but later it was because she had some itching in the itching sensation and rashes on the body, so they were scared whether it is monkeypox case, but later they found out that it was not a case of monkeypox. So there are a lot of things that can happen. So identifying this at the initial stage would be the best option, so that you can try to give suitable treatment options or suitable things which they can follow, so that they do not start spreading it from the one person to the next person. So there is a antiviral drug which is developed, which is called as tecovirimat. Okay, so this is approved in US. So this is an antiviral medication. So this was used priorly for smallpox. So this since monkeypox is almost similar to the smallpox, they are trying to use this for monkeypox, and they have seen that it is quite good enough to stop the replication of this virus. So basically, if the virus is not able to replicate, if the viral envelope formation is not happening, then the virus cannot spread. So they are trying to tackle this, where this basically this antiviral drug will act on the virus and see to it that the virus will not develop these kind of envelopes. And once they do not develop envelopes, they cannot multiply and they cannot lead to further transmission. So that is how these kind of antiviral drugs are acting. So this is just to show you how a virus enters your cells, how it multiplies and how it comes out and transmits. So just to show you simple way of that. But basically these antiviral drugs will attack this. So you can see there's a cross mark here. That means it will not allow the viral replication and viral envelope formation, because of which the virus dies. And if virus dies, definitely it cannot spread the disease. So this is that tecovirimat drug which has been used. So basically this virus is a double-stranded DNA virus, and as I told you, it was an endemic thing which was seen in Central and Western Africa, but now it is seen in many of the countries, like you might have heard, it is seen in US and various other places which are not endemic. So basically the reason might be travel history and other reasons of not following the protocols properly. So raising awareness and educating people about this is very, very important, and isolating the person. So if anybody is having this monkeypox infection, as in the case of COVID, where we try to isolate them from the rest of the people, the same mantra can be good even here by isolating the people, and following hygienic practices also helps. And apart from that, if you can try to use PPEs, that is personal protective equipments, when you're taking care of such people. So definitely there is no much treatment available as on date, but definitely whatever treatments they are trying to use for smallpox, they are trying to use even here. And even same case, the vaccine that is used for smallpox, they're trying to see if that can be useful for this treatment also. So lymphadenopathy, okay, this is the thing that I told you about the lymph nodes that are swelling. Okay, so this is the major identification that the person who was suffering might be suffering from monkeypox, because fever, headaches and all are symptoms for many, right? So there can be misinterpretation of whether it is monkeypox or whether it is something else. So this one symptom will be very, very useful in identifying that the person is suffering from monkeypox. Apart from that, definitely PCR I have already told you. So you can send that samples to NIV Pune, and they can do the PCR and confirm that this particular person is suffering from monkeypox. So in this way, I think this would be helpful in identification, and creating awareness only can help in coming out from this particular disease. So stay vigilant, stay safe. So thank you for watching, and thank you for supporting me till date. If you have liked this video, please like this video. If you feel it is worth sharing, please share it with other people so that I can make much more educational videos for you like this. Thank you.